Hi, good evening, everybody. Hope you can hear me. Thanks for coming on. We're going to be, we've had a lot of questions from patients and quite a bit of uncertainty about what actually is happening with the current COVID situation and the operating that's going on in the operating theaters and what the lists are doing, and whether we actually are able to do any surgery. So I just thought of having a webinar to clarify around that, and as well as just answer some common questions that patients tend to ask, and to get webinar started for this year. Okay, so let's go on to. So one of the main questions are, what are the current restrictions with elective surgery in terms of COVID, because of COVID? So as you're aware, from March, the government had, WA state government has made a ruling that even in private hospitals, we can't do any elective surgery, mainly what we call category 2s and 3s. So what we consider a category 1 is anything that's life-threatening, cancer operations, those sort of things. So those sort of surgeries we were allowed to do. Category 2 types of operations are those that within 30 days, 90 days, we don't do the operation, there's a significant deterioration in the patient's condition. Unfortunately, most of elective operation such as bariatric surgery, weight loss surgery, orthopedic, hips, joints, those sort of things come under what we call category 3. Because of this, we were unable to do any surgery from March till first week of May, up to the 8th of May. And those patients that I'm still able to do some surgeries, mainly because they were booked in for the operation before February. So 9th of February, anyone who saw us before then, we've put the paperwork in, we were allowed to do some operations for these patients, and we've been managing to help a fair bit of our clients because we had preemptively seen them early and booked them early, and that's been good in a way. So the what's going to happen at the moment is, even though the government's sort of eased a little bit on the restrictions, so they've said we could start doing a bit more surgery now, but the hospitals, each hospital has got their own rules and their staff availability, and because they've had to give people some long-term leave, especially the private hospitals, because they were not going to keep them hired while there wasn't any surgeries going on. Hence, it's a bit hard for us to kick back into full gear straight away, because mainly staff on leave, as well as staff who've been affected by COVID-19 and or their family members. And there's a lot of people who've been in isolation because of this. And it's even in my operating theater, a few of our nurses had developed or were close contacts, and we had to slow down a bit because of that. So this is one of the main problems at the moment. It's not just in the hospitals. If you go to pretty much any business or any place of where you have frontline staff manning things, it is unfortunately something that you can't do remotely, and they have to be having time off. So the other questions that people may have is, does getting COVID-19, what's going to happen to me? Is my weight or is my health going to be important role in how we recover from this? So there's enough evidence that's been gathered over the last 2 years that have shown that people who have excess body weight, struggling with obesity, and have any underlying comorbidities such as diabetes, sleep apnea, and those sort of weight-related problems, they have a significantly higher risk of complications from if they develop COVID-19. So someone who's got normal weight and someone who's got like 30, 40 kilos more than they should, the people who've got carrying excess weight have a higher hospitalization rate, they have a higher incidence of being admitted to intensive care, and also ventilation mortality rate. In saying that, this is, even without COVID, this is definitely a higher risk for patients who have the same disease, even if it's not just COVID-19. So certainly it's important to look at controlling our weight, because it will affect outcomes of any disease adversely. If we may feel healthy and feel I don't have any problems at the moment, but at the time you develop something, maybe an appendicitis or gallbladder problem, or someone's got a cancer for some colon cancer, anything like that, the whole outcome is significantly higher complication risks with related to surgery, recovery, anesthesia, if we are carrying excess weight. So that's something we should consider for sure. Okay. And then another thing is people ask, I'm a bit afraid to come into the clinic. Do you do telehealth? Yes, we do. We have various ways of doing telehealth, from things like Zoom meetings, Skype meetings, just telephone consultations. And a lot of GP practices are doing this as well. And just like every other industry, we've sort of been able to fortunately use the technology that's available to be able to give good information, have a good online discussion with people, not face to face, but at least through video conferencing. And that's, a lot of people find that very helpful. And we've been able to do that, and we are still continuing to do that. And we have, out of my clinic, at least a third to two-thirds on sometimes are just telehealth at the moment. And we are more than happy to do that for you. So if anyone's interested to have a chat with us on a telehealth conference, we can certainly organize. It's just, all we need is a referral from a doctor, so that we'll be able to bulk bill the initial consultation. And then one of the other questions, do I need to have private health insurance to undergo weight loss surgery or bariatric surgery? Ideally, yes. So it'll be good to have private health insurance, as it covers a significant amount of the cost of the operation. In, say, for example, a sleeve that may cost anywhere between $20,000 to $24,000. Your actual out-of-pocket cost will be in the vicinity of $3,000 to $4,000 if you have private health insurance. Some people have no interest in getting private health insurance. They just don't like the thought of it, and they're not interested in paying them money every year. Then if they've got money in their account and they want to self-fund, which some people do, then we're happy to take on those patients, or accessing your super through a compassionate release is an option as well. And the other thing is going and getting insurance now and coming to see me towards the end of the year, so we can book for surgery for early next year. So that's another way of accessing options to get the operation done. The other question that we get, how long is it going to take me to get back to work? Am I going to be down for a long while? I need to get back. If I don't go to work, I don't get paid. How does this affect things? So usually surgery is not something that's going to keep you in hospital for too long. About 70% of my patients go home the next day after even a gastric bypass or a gastric sleeve surgery. Some people, same operation done on 3 people, 2 will go home. The next person, they just take a bit longer. They need to stay another day. That's fine. So some people need an extra day just to get the fluid levels up and be comfortable drinking before they can go home. And majority of people are driving when they come to see me in a week after the operation, and going back to work. If you're a desk job, by a week, you should be able to get back to work. If you're flying in, flying out, mining site, ideally maybe 2 weeks should be good. If you do actual physical manual laboring type work, we would advise somewhere between 2 to 3 weeks to take some time off. And pain, yes, everyone's afraid of pain. So that's one of the main questions. Most people don't find it too painful. The first 24 hours, I gotta be honest, can be a bit rough. Patients will feel a fair amount of nausea, a bit of discomfort in the chest. These things are quite common after the surgery. However, we've do these operations so regularly. Then our team, including anesthetists and recovery staff and nursing staff, are all well geared to manage this. We have a whole heap of medication just for nausea and vomiting. We've got 3-4 different types of drugs. For pain, we've got a whole barrage of medication that we can use, and we pretty much get on top of any pain issues fairly quickly. And within 24 hours, most people are quite comfortable. And by 3-4 days post surgery, it just gets better and better. It's hardly a thing after a few days after the operation. So if you're worried about pain, don't worry too much. All the surgeries are done through little keyhole operations. I've never had to do anything open for weight loss surgery. So biggest cut is 1.5 centimeters, just 15 millimeter incision. And those cuts in themselves are hardly any pain in those. So it's not a very painful procedure. And then one of the other common questions, how soon can I get back to eating normally? So essentially, well, if you're looking at normally, it depends what your concept of normal is, okay? Because eating is going to be changed for life in your lifestyle. So it's not going to be the same as what you're going to eat now and after surgery. Everything is going to be smaller in portion sizes. You're going to eat slower. You got to chew your food properly. So all of these things are going to change. And for the first 2 weeks, you're going to be on a liquid diet while we allow those cut edges on the inside, the staple lines, the suture lines, all of those to heal up. Once those things have healed up, then we go on to sort of a puree diet and step up onto a normal diet, which in turn takes anywhere between 2 to 3 months for you to get really comfortable with the new anatomy that we've created with the operation. Most people will be able to eat most things, and there will be some changes, but in general, the quality of eating with any of the current operations are quite good compared to someone who's had, say, a gastric band. And with the gastric band surgery, you can't really eat anything that's good for you. So people end up making poor food choices because of that. However, the new surgeries, the new operations, they are much more friendly in terms of giving you quality of eating. So that's not really something to be too concerned about. And what can we expect in terms of weight loss? So majority of people are going to lose anywhere between 60 to 100% of their excess body fat. So when we say excess body fat, if you take a normal BMI, say 25 for your height, if you're meant to be 70 kilos, if you're like 30 kilos extra, you calculate based on that. So it's 10%, 50% of that, or 80% of that. So different operations give different levels of excess weight loss. So once we have a discussion with the patient, we'll assess how their lifestyle is, what their exercise levels are, what they're capable of, and how motivated they are. And then all of these things play a role on deciding the right type of surgery and what the aim and target of your weight goal is in the long term. And the surgery is tailored to achieve those results the best we can. In saying that, this is a medical therapy, just like say diabetes or hypertension. There's not one medication that's going to fix everyone's blood pressure or going to stop everyone's diabetes. So the same medication may work very well on someone very similar size, similar age, but then someone else may need 2 tablets. So in the same way, surgery works well for majority of people. For some, the type of surgery may not have be giving them the desired results. Then we can do extra different surgeries or different medication and look at adjuncts to be able to achieve those results in the event you're not getting that result that you were wanting, which is usually less than 10% of people. Okay. And then the other question is it going to get rid of my diabetes? Is it going to improve my sleeping? Is it going to get rid of all those body aches that I have? Yes, that's significant improvement in all weight-related conditions. Things like type 2 diabetes, depending on type of the surgery, there's a between 70 to 90% remission rates in type 2 diabetes. We've had patients who've been on insulin and 3 to 4 different types of drugs who then go on to have nothing on board. And heart disease coming off lot of medication for that, as blood pressure as well, sleep apnea, coming off the CPAP machine. So all of these things will show significant improvement with the weight loss. Even without surgery, just having 5 to 10% body weight loss will show difference in your diabetes management. But with the surgeries that we do, you find very dramatic improvements within a few weeks, significant improvement in the sugar levels. So it is a proven and very effective way to deal with weight-related complications. And the other question, am I going to be able to socialize? Do I have to make lifestyle changes lifelong? Yes, it's important to make lifestyle changes. If we want to change, we got to make some change. If we go about doing the same thing and expect different results, it's not really going to work very well. It's quite important that we take ownership for our own health and use the tool that we give you to provide and to be able to get that long-term weight loss. And it's not hard, just need to take a little bit of time, 3-4 times a week, to do some exercise, which we will advise on what to do, and making good food choices as we are unable to eat large amounts as we normally do with a normal stomach. With these types of surgery, it's going to be smaller portion sizes. So it's very important we make those appropriate right food choices in order to avoid any long-term issues such as nutritional deficiencies. So it's important to make a lifestyle change. This is not a shortcut. It is a very effective weight loss therapy in conjunction with a lifestyle change. So that's what I always tell my patients, and most people take that on board. They just needed that extra help to get results. People get really frustrated just going to the gym and trying to lose that weight, and nothing's shifting. But with the operation, that's not a problem. You're going to lose that 10, 20, 30 kilos initially without any problems. And that in itself is a huge motivation for most people to use the tool properly for long-term results, which we are trying to achieve. And then it's not a sleeve and leaf surgery that we have. We have a very good support network. We've got 4 dietitians, exercise physiologists. We've got a psychologist that works with us. So all the health professionals in the team are there to support our patients throughout the journey and to ensure that you have a successful long-term outcome. And all of us are easily accessible and more than happy to be contacted anytime to get some advice, to get people on track. Pretty much, even the other day, I had a couple of my patients who haven't been seen for a few years turn up, or doc, I've been doing so well. I know what I've been doing wrong. I need some help. I want to get back on track. Fair enough. You got to understand where you're going wrong and come and seek help. And we got them all back on track. And there's a lot of things we can do to help patients to get refocused again. And that's the important thing. It's not to just give up, but to get up and dust yourself off and keep going. And that would be the end of the session. So we've got a question and answer chat open there. If you've got any questions you'd like to ask, you can just jump on and we'll answer your questions for you. So please feel free to do that. And if you'd like to, come and have a chat with us, we are more than happy to do that as well. Okay, so we've got someone typed in, what's the top tip approaching Easter period and over the weekend? What do we do? Well, important thing is to keep active, not to just use that time to be sedentary, making good food choices, ensuring that we, if there's any food that's tempting, perhaps trying to avoid keeping that at home, engaging with your family, using all this access that we have online to read through some articles to improve your understanding of different things. So these are things that certainly we would advise over the holiday period. And that would be our main tip, I'd say, for that. Yeah. Yep, someone's asked, how soon can we see you if we got a referral? That is usually our wait period to see me would be somewhere between 2 to 3 weeks. So if you are able to get a referral and book in, you just normally within 2 to 3 weeks you'll be able to see us. And at the moment we're booking patients in to have surgery somewhere in June at the stage. So about 6 week wait time for surgery at the moment. So another question is, why can our new tummy stomach more foods than others, such as bad foods over good foods? So I'm not really sure what we're trying to what the question is. Let me just try to answer it as much as I can. So the new tummy is small. Okay, so for example, a gastric sleeve operation is your stomach size from say a liter and a half capacity is going to be down to about 150 mils. So the ability to fill that has to be going to be so much smaller. So anything just taking a small, say for example 2 slices of sushi will fill you up. And it's quite important to just stick to those appropriate types of food, because any of the high sugar, high carbs, refined type of food is not going to sit very well in any of these operations, because it will generally tend to make you feel a bit unwell if you ate them, as most of these rich carbohydrate and sugar food, as they pass through quickly into your stomach cavity, end up causing issues. They will make you feel a bit sweaty sometimes, or if depending on type of surgery, you can get something like what we call dumping syndrome. So that in itself, people then start making the right types of food choices, and also the hormonal changes that goes on with the operation makes a difference as well. Hope that answers the question. Okay, I think that's the last of the questions, and I'd like to thank everyone for jumping in today. It's a pleasure to chat to you all. We'll endeavor to come up with some other topics in the next few months that we will be able to share our thoughts and be, giving you some information, and also to answer questions if you like. And hope you have a good, safe, long weekend. We'll chat next time. Take care.